The Faith Treatment and Rehabilitation Center has been home for Paul Kioi Gachane, an assistant chief of Runyeki area in Murang'a County for close to 90 days. He is an alcoholic battling chronic alcoholism together with tens of others here. It is an habit which not only took a toll on his health but also wrecked his marriage.
Mimi ni mzee, niko na familia. Nilikunywa mpaka uhusiano wangu na bibi yangu ukapotea. Bibi akatoroka. Na wakati huo nilikuwa naona bibi ndiye mbaya. Lakini kwa ile wakati nimekaa hapa nikasoma, nikaelezewa na nikakuja kugundua vile pombe inakuja inakigeusha pole. Najua hiyo mambo yote kuhusu akina kutoroka kwa mama Tony najua ni pombe.
With his 3 decades of marriage gone in a flash, Paul turned to his drinking buddies for solace, but he says they were the first ones to turn their back on him when his condition deteriorated.
Hakuna kitu urafiki, sababu mimi niko hapa miezi 3 na hakuna hata mtu mmoja ni sawa hiyo pale kwa gate ati nilikuwa besti ananiajua ati Kioi ni besti tunakunywa na yeye wapi.
Ironically, he found himself at the center of government's efforts to eradicate the consumption of illicit brew in the area. He soon hopes to leave this place to reunite with the world and play his role in steering the fight against the illicit brew wholeheartedly.
Nilikuja hapa nilikuwa katika hiyo position na bado niko kwa hiyo position. Ile kitu nakwambia, pombe huwa inakubadilisha pole pole. Imagine mimi nilikuwa nakunywa mpaka nalala kwa kichaka, nakuja mahali kama hapa nafikiria nimefika nyumbani. Mimi natoa koti na hang hapo. Na mimi nalala hapo chini. Usiku ya manane mimi nakoka kitara namna hii. Tunasema mama Ken uko wapi? Kuwe niko kichakani nimelala huko.
At the same facility is 40-year-old Henry Washira. He is a former accountant at a popular golf club in Nairobi. Besides that, he has worked for more than 10 organizations but cannot account for the wealth he accumulated thanks to his love for the bottle. His marriage of 21 years succumbed under the weight of the vice. His biggest regret is that he failed to invest but hopes to start from scratch once again.
Nimekuwa nikitumia pombe kiholela na kunywa kila wakati. Hakuna kazi ambayo naweza kuweka juu ya pombe. Nikipata kazi huwa tu inaenda hivyo juu ya pombe na ndio sababu nimekuja hapa.
Was there is light at the end of the tunnel for the 2 gentlemen in this rehabilitation center, the future is still unclear for Margaret Mudhoni, who feels that her life has hit rock bottom. To her, the only solace is in the bottle.
Wakati nitoka kwake, hata nilikuwa nimekaa miaka 4 bila kukunywa. Nilikunywa tu juzi. Juu ya stress. Juu nikijifungia hapa nikae hapa nitakufa ama nijinyonge kwa nyumba ama ninyonge watoto. Fadhali nitoke na huko tuongee na watu hivi. Nikimwambia stress zangu naye akona zake.
Alcoholism in the central Kenya region has been a worrying concern for years, so much so that 6 years ago, President Uhuru Kenyatta summoned Mount Kenya members of parliament to State House in Nairobi, declaring that, quote, agenda number 1 as pombe, number 2 pombe, and once again number 3 pombe. The president stated that the country was in the throes of a drinking crisis fueled by the availability of cheap, illicit alcohol, with dire warnings of an entire generation being lost to booze. So alarmed was he that he ordered the assembled legislators, the paramilitary police and the citizenry to, quote, move from door to door, closing all outlets selling the illicit drinks. The efforts, those of the head of state and other leaders, however, did not deter people from drinking. In Murang'a, a multi-agency team has been formed to crack down on the brewing of illicit alcohol and selling of the counterfeit liquor. During the crackdown last month, under the Rapid Response Initiative, more than 100 people were arrested for engaging in the sale and consumption of illicit brew. The county commissioner also admitting that the next generation is at risk if they continue to fall prey to this vice. The stress of the pandemic and lockdown life, so many seek the comforting embrace of alcohol. Many reacted to COVID-19 by drinking the most.
And out of all these initiatives, I think Central Kenya has been in the news mainly because of this. And also the members of the public, there's a lot of awareness. They always talk about it. Anytime there's an opportunity, they bring it out.
Kuna watu ambao wamekuwa addicted mpaka akiamuka asubuhi wanaongea, huwa wanasema anaenda kufungua lock. Hawezi kufanya kitu chochote mpaka afungue lock. Na hiyo kufungua lock ni kukunywa. Na akisha kunywa lazima maintain hiyo status. Mtu kama huyo hawezi kufanya kazi ya maana, hawezi kufanya kazi ya sulubu. Kama ni mwanaume hawezi kufanya kazi ya wanaume. Na hata wengi wameshtakiwa na wake zao ya kwamba hata majukumu ya kule nyumbani hawatimizi vilivyo.
When alcohol strikes a community, productivity and anything that goes to support life disappears, including actual impotence. So in Central there are places where, I'm sure you know probably better than me because in your work you move around. Schools have been closed, nursery schools have been turned into other things because there are no children.
Latest surveillance by National Authority for Campaign Against Alcohol and Drug Abuse, NACADA, paints an alarming picture. As NACADA and other government agencies put efforts to fight the vice, experts have warned that the obsession with alcohol in this part of Kenya could soon be difficult to reverse. And with elections approaching, concerns have been raised of possible spike in indulgence as rogue politicians are known to give alcohol to youth to advance their agendas.